Hello ladies and gentlemen, and welcome back for more Let's Play Trauma Second Opinion. In the last episode we did 6-6, The Future of Guilt. In this episode we're going to be doing 6-7, Fallen Heroes. Sir, I have an update on the situation. Dr. Asherin has been infected. Mr. Alex Yang is also infected. Professor Ritz has been affected. We've confirmed Dr. Mafaus as well. There are 22 others who have been confirmed to be infected, 7 of whom show full chiral reactions. This is a disaster. Guild is going to sweep the modern medicine in one fell swoop. Panicking isn't going to save these people, Langston. We're going to stop this if at all possible. I'll be helping with the operations. Thank you, Robert. Dr. Stiles, Dr. Kimishima. I need you to operate on the 4 patients the sergeant just mentioned. Understood. We need to get started. I understand this is a dire situation, but I sincerely appreciate your help. Where is Dr. Owen? Sir, there has been no sign of Dr. Owen for at least 30 minutes. What? Unacceptable! He should be abandoning his duties at a time like this. How does this affect the situation? We extracted samples from Adam in order to create a serum to combat guilt. Dr. Owen is the only person who has access to them. Mind if I try to get more? True, you might be able to. This is the only guaranteed cure, but you know there are certain risks when handling guilt. I'll explain the procedure, but you must be careful at all times. Please follow me, Dr. Hoffman. We'll send the serum as soon as we can, Dr. Stiles. Do your best until then. Understood. I have a plan. Dr. Stiles, Dr. Kimishima, you will both alternate treating these 4 patients. In other words, you'll each perform 2 procedures. The patients are being brought in. Let's get to the operating room then. There isn't any time to waste. Alex Yang, 72.7 inches, 175.8 pounds. Chiral reaction positive in multiple patients. However, it is unclear what strains of guilt is or are involved. There are a total of 4 patients who require immediate treatment. You'll both alternate patients so that one of you can keep an eye on the other 3. Got it. While Dr. Stiles is operating, you'll need to prep for your next procedure. Please adjust your routine accordingly, Dr. Kimishima. Once Dr. Stiles closes his patient up, we'll move on to yours immediately. Understood. Take time between operations to calm down and refocus on the task at hand. Each of you will have 2 patients, meaning we'll complete 4 procedures total. This is like the time we had 10 minutes to treat 5 guilt patients, remember, Angie? This time there are only 4, and we have 2 doctors, so I'm going to be optimistic. However, judging by this guilt data and the patient information, this is an entirely different situation than before. Even with 2 of us, it's going to be our hands, we're going to have our hands full. We're running out of time. Dr. Kimishima, we have to save these people. We won't let them die. The test results are here. It's showing up as triti and it seems to be affecting the pancreas. So this one I actually failed like 3 or 4 different times. It is kind of difficult to do 4 patients at once, so... And of course, because I'm a wimp, I use a healing touch to get this one taken care of. So, and you only can use healing touch once, so you have to choose, if you want to use it, you have to choose either to use it on, for Derek, the first one or the 3rd patient, and for Kimishima, the 2nd or the 4th. But you don't have to use it at all if you don't want to. I just don't like these triti ones. I'm not very good at it, even though it seems easy. If you do it wrong or take too long or something like that, the triangles will form, as you've seen in one of the triti things I did. But so we're done with that one. So let's go ahead and finish this and move on to the next patient. That went well. Has the next patient been anesthetized and prepped already? Yes, please get ready for that procedure while I assist Dr. Kimishima. We can't waste too much time between patients. Alright, I understand. Good luck, Dr. Kimishima. I'm partially responsible for this, and yet here I am fighting to stop it.
Let's begin.
But it's a little too late to start worrying about things like that. It looks like this patient is suffering from kiriaki in their left lung. So this one's going to be kind of simple. Pretty simple actually, because it's just kiriaki, so. But of course, like always, first you have to just take care of the wounds real quick before the kiriaki will even show up, so. Alright, so as soon as you fix that, the kiriaki will show up. So just, best thing to do, I find, is to try to see if you can find both kiriaki and just make them both appear, so. Oh, sorry about that. So, just get that one, and then, eventually. Well, for some reason he isn't wanting to show up, but there we go. Alright, so just go ahead and zap them, of course, like always. So the cow reactions are down to 50%. Keep attacking the kiriaki as they appear. So here we can just go ahead and get these kiriaki. So for some reason I'm having trouble getting that one. Usually I don't have this much trouble with doing the kiriaki, but so, come on, where is it at? There it is. Alright, so go ahead and zap them. The vitals are dropping, so we're going to have to take care of that soon. So, since the laser is out, just go ahead and do that. And I defeated him, so that gives me some time to go ahead and do this before I start healing his wounds. So, try to do it as quickly as you can without messing up like I did. Because, like you said, you only had 10 minutes to do this, and I believe you have to actually finish all the patients. I don't think if time runs out, like on the one where we have 5 patients, I don't think it'll just let you just go ahead from there. So, and here we go. So we have 2 more kiriaki. We have the major one and another small one. So yeah, there's a small one right there, you can see. So I decided to make the small one appear real quick and defeat it first. So for some reason I'm having trouble getting it though. There you go. So this won't be too bad. Just go ahead and make them both appear, zap them, and boom. Alright. So of course, just like we've always done on this big one, just you have to, it appears back inside the lung after it disappears. So, and oh, one more time. Cow reaction is negative. Once you clean up, we're done. So make sure you don't let them die. It would suck to have your patient die when you're this close to finishing it, because I believe this was only the second one. Never mind. The next one is the one that I kept failing on. How, I don't know, but I did. And the patient kept dying on me. So there I didn't realize there was actually 2 small ones that were close together to make it look like a big cut, but eventually I figured it out. That shouldn't even been a cool, but I'm not going to complain. Alright. Okay, Dr. Kimishima, I'm going back to assist Eric. Once he's finished, you'll be operating on the final patient. Good, I need a minute to relax. Don't worry, I'll be ready as soon as Styles finishes the procedure. Good, the special guilt serum just arrived. We're all set to go. Okay, stay calm and keep it steady, like Dr. Casal always says, right?
Let's begin.
The Deftra is in this patient's stomach. Good luck, doctor. Alright, so we have the Deftra. If you don't remember what it is, you're about to remember. After we drain the blood. What? They never mentioned this hemorrhaging. We can't start treating the guilt until we take care of all this. Alright, so now we have to drain all the blood before the guilt will appear. Huh? I can't locate the source of this hemorrhaging. Does that mean it's sent them somewhere else? We don't have time to search for the source of the hemorrhaging. Let's just worry about this for now. What? You're going to treat the guilt through all this blood? Do you have a better idea? In that case, we don't have much time. This is an emergency, so we need to get that guilt out of his system. You're right. Drain the blood and continue with the Deftra extraction process. Continue using the drain as the blood accumulates. That's our plan. It won't be easy, but here we go. So, and like I said, the easiest, I think I said this the last time we were doing it, the easiest way to make sure you get the right ones is to try to, or get the two separate colors to mix, is try to use the laser to try to scare them towards each other. So that does actually kind of work from what I've experienced anyway. So, and make sure you don't let your vitals go down, that would be bad. So alright, so now we have to cut it out since we did this one. Here we go. Drag it. Make sure you don't let the patient die on you here. So as you see, there's a whole bunch of tumors we got to laser and blood to drain. So I decided to try to take care of all the tumors before taking care of the Deftra. So I figured that would be the best thing to go ahead and do real quick. So that's what I'm doing right now. So the only time they actually make tumors, if I remember correctly, is if the two same colors get together, and you really don't want that to happen if you can avoid it. So, but I'm scared because every time I had, well, actually they just appear sometimes too. You just appear with one. But I get scared because every time I've had the vitals down to like 40 and tried to cut through, the patient wound up dying on me. So, and the blood was blocking that one, so I couldn't cut it, which was really stupid. But anyway, so, and there we go. So we're done with that one. So let's go ahead and close it up. And put the bandage on. There we go. I received news from the other people who came into contact with guilt. They're all stable for the moment, so this will be our last emergency operation. Ah, that's good news. Once Dr. Shun is finished, we can finally relax. This is the last patient. The guilt involved is Paraskevi. I'm afraid it's already reached the heart. That's alright. It hasn't progressed too quickly. I should still have enough time. All I need to do is concentrate. How hard could that be? Could it be? I'll do everything I can to support you. We're going to save him. Whatever you do, keep the guilt out of the patient's heart. Yeah. So anyway. So of course, like always, we need to go ahead and treat the lacerations before the Paraskevi appear. And there we go. So, like always, we just use the surgical laser to zap it. I decided to go ahead and just, since I didn't use my healing touch, I decided just to use it here. So, as you see, as I'm cutting it, it's leaving marks. So, I become really worried. So, and I can never remember how many times you should zap it before it's small enough to pick up. So I think here I try to pick them up and I realize, oh wait, they're not small enough. So yeah, see. So, but there's a couple I forgot to zap again. So I wind up, some of them I wind up picking up because they get kind of confused with each other. So like that was too big. So we've almost, yeah, that was small enough, so go ahead and pick it up, of course. Oh, nope. So just pick up whichever ones I can. So of course I zap around, so I zap all of them. So Oh shoot, one of them was burrowing into the heart. I don't know which one, but I think you'll know which one is doing it whenever its tail starts moving. I believe that's how you're supposed to be able to tell. So, tail. Anyway, got to tail to tail. So that was too big.
Vitals dropping.
And as you see, the more cuts it is, the more difficult it is to put the vitals up. So gotta be careful from that, and make sure when the tail's moving, make sure you zap it, because I think, like I said, I think that's the indication that it's about to burrow into the heart. And these you can't let burrow at all, so otherwise the patient will die on you. So as you see, I'm having even a whole thing of the medicine to put up the vitals is not doing very much. So that was too big. That was not. That was too big. This one is not, and this one is not. Okay, so those two we only have to zap one more time, I believe. Zap it with the laser and hit them with the what's it called? The scalpel? Yeah. One more time. So there we go. So we should be able to pick them up now. So I'm trying to I tried to put the vitals up some, that way I would have enough time to be able to grab them. So, and 3 and 4. Alright, so as soon as I grab that one, now we're done. So periscopic extraction complete. Remember to treat the other problem areas. The vitals started dropping, so I need to put the health up as much as I can. I'm trying to get it to at least the green area, that way I'll have plenty of time to try to heal these wounds. So as you can see, this one is pretty difficult. If anybody can do this better than me, I would love to see it. I've actually have seen LP or playthroughs and walkthroughs, or people have done a lot better than me. I think I can't remember if Brain Scratch Comms, if they did this one or they did Second Blood or New Blood, but Ted's a lot better than this at me too on that gun. But perfect. Now insert your incision and we'll be done here. Yep. So
Not much time left.
of course, I'm pretty sure almost anybody who plays this game is better than me, but that's the last one, right? Yeah, we have confirmation on that. Good. I'm glad we were able to treat all the 4 of them. It's a relief. Yes, but we can relax now, at least for the moment.
Nice work, Dr. Styles.
You both did an amazing job, Dr. Styles, Dr. Kimishima. Alright, so there we go. So we've healed all 4 of these patients, so that's the end of that section. And I get a C rank, which I deserve because I did very poorly, but at least I passed it. That's all I care about. But anyway, that is it for this part. So next time we will begin the final part of this playthrough, 6-8 Vulnerability. So until then, thanks for watching, everybody, and have a great day.